Welcome. Today, we're diving into the essential questions postpartum parents should ask during their annual physical. The postpartum period brings many changes, both physically and emotionally, and your annual checkup is the perfect opportunity to address lingering concerns, track your recovery, and set the stage for long-term health. Whether you're a new parent or several months into your journey, knowing what to ask can make a big difference. Let's explore the key topics to discuss with your healthcare provider, ensuring you get the most out of your visit and feel empowered in your postpartum care. After childbirth, your body goes through significant changes. At your annual physical, it's important to ask your doctor about your physical recovery. Questions might include, is my healing on track? Are there any lingering symptoms I should be aware of? Should I be concerned about pain, bleeding, or changes in my body? Your provider can assess your recovery from delivery, whether it was vaginal or cesarean, and help you understand what's normal and what might need further attention. Don't hesitate to bring up any discomfort or physical changes you've noticed since giving birth. Pelvic floor health is a major concern for many postpartum parents. During your checkup, ask your provider about the state of your pelvic floor. Are you experiencing any incontinence, pelvic pain, or pressure? These symptoms are common, but shouldn't be ignored. Your doctor can recommend pelvic floor exercises, physical therapy, or further evaluation if needed. Openly discussing these issues helps prevent long-term complications and improves your quality of life. Remember, pelvic floor health is vital for overall well-being, especially after childbirth. Your menstrual cycle may change after childbirth. It's important to ask your provider what to expect regarding the return of your period, changes in flow, or irregular cycles. If you're breastfeeding, your cycle may be delayed or irregular, which is normal. However, if you notice heavy bleeding, severe pain, or other unusual symptoms, bring them up during your appointment. Understanding what's typical and what's not can help you feel more in control and less anxious about your body's changes. Breast health is another important topic for postpartum parents, especially if you're breastfeeding. Ask your doctor about any lumps, pain, or changes in your breasts. Discuss concerns about milk supply, nipple pain, or infections like mastitis. Your provider can perform a breast exam and offer guidance on self-exams at home. Early detection of any issues is key, so don't hesitate to mention even minor changes. Keeping your breasts healthy supports both your well-being and your baby's nutrition if you're nursing. Mental health is just as important as physical health, especially after having a baby. At your annual physical, talk openly about your emotional well-being. Ask your provider about signs of postpartum depression or anxiety, and discuss any mood changes, sleep issues, or feelings of overwhelm. Your doctor can recommend resources, therapy, or medication if needed. Remember, seeking help is a sign of strength, not weakness. Prioritizing your mental health benefits both you and your family. Sleep can be elusive for new parents. During your checkup, ask your provider about healthy sleep patterns and strategies for improving rest. Discuss any trouble falling or staying asleep, and mention if you feel excessively tired during the day. Your doctor can help identify underlying causes, such as hormonal changes or stress, and suggest practical solutions. Good sleep is essential for recovery and overall health, so don't overlook this important aspect of postpartum life. Nutrition plays a crucial role in postpartum recovery. Ask your provider about dietary recommendations tailored to your needs, especially if you're breastfeeding. Discuss any concerns about weight changes, vitamin deficiencies, or energy levels. Your doctor can suggest supplements if necessary and help you create a balanced meal plan. Proper nutrition supports healing, boosts energy, and helps you feel your best as you care for your growing family. Physical activity is important for postpartum health, but it's normal to have questions about when and how to resume exercise. Ask your provider about safe activities, how to rebuild strength, and any restrictions you should follow. Discuss any pain or discomfort during movement, and get advice on setting realistic fitness goals. Your doctor can recommend resources or refer you to a physical therapist if needed. Staying active supports both physical and mental well-being. If you had any chronic conditions before or during pregnancy, such as diabetes, hypertension, or thyroid issues, your annual physical is the time to review their management. Ask your doctor how these conditions may have changed postpartum and whether your medications or treatment plans need adjustment. Keeping chronic conditions under control is vital for your long-term health and your ability to care for your child. Pregnancy can affect your cardiovascular system, so it's important to monitor blood pressure and heart health postpartum. Ask your provider to check your blood pressure and discuss any symptoms like dizziness, headaches, or palpitations. If you had high blood pressure during pregnancy, follow up on your risk for future issues. Early detection and management can prevent complications down the road. Thyroid issues can develop or change after pregnancy. Ask your doctor to check your thyroid function. especially if you notice symptoms like fatigue, weight changes, or mood swings. Thyroid imbalances are common postpartum and can affect your energy and mood. Early diagnosis and treatment can make a big difference in how you feel day to day. Bone health can be impacted by pregnancy and breastfeeding. Ask your provider about your risk for osteoporosis or bone density loss, especially if you have a family history or other risk factors. Discuss calcium and vitamin D intake and whether you need a bone density test. Taking care of your bones now helps prevent problems in the future. Sexual health is often overlooked, but is an important part of postpartum well-being. Ask your doctor about when it's safe to resume sexual activity and discuss any pain, discomfort, or changes in libido. If you have concerns about intimacy or sexual function, your provider can offer guidance and support. Open communication helps you feel more confident and comfortable as you adjust to life after childbirth. Family planning is an important topic for many postpartum parents. Ask your provider about birth control options that are safe and effective for you, especially if you're breastfeeding. Discuss the pros and cons of different methods, and consider your future family goals. Your doctor can help you make an informed decision that fits your lifestyle and health needs. Vaccinations are an important part of staying healthy, especially postpartum. Ask your doctor if you're up to date on recommended vaccines, such as the flu shot, Tdap, or COVID-19 vaccine. Discuss any concerns about vaccine safety, particularly if you're breastfeeding. Staying current on vaccinations protects both you and your baby from preventable illnesses. Annual physicals often include screening tests for conditions like diabetes, high cholesterol, and anemia. Ask your provider which tests are recommended for you based on your health history and postpartum status. Early detection of these conditions allows for prompt treatment and better long-term outcomes. Don't hesitate to ask for clarification about any tests or results. Digestive issues can arise after childbirth, including constipation, hemorrhoids, or changes in appetite. Bring up any digestive symptoms you've noticed and ask your provider for advice on managing them. Your doctor can recommend dietary changes, medications, or further evaluation if needed. Addressing digestive health helps you feel more comfortable and supports your overall well-being. Urinary issues, such as incontinence or frequent infections, are common after childbirth. Ask your provider about any symptoms you're experiencing and discuss ways to improve urinary health. Your doctor may recommend pelvic floor exercises, lifestyle changes, or further testing. Addressing these concerns early can prevent long-term problems and improve your quality of life. Many parents notice changes in their skin and hair after childbirth, such as hair loss, acne, or stretch marks. Ask your provider what's normal and what might need treatment. Discuss any concerns about rashes, moles, or other skin changes. Your doctor can recommend products or refer you to a dermatologist if needed. Taking care of your skin and hair helps you feel more confident as you adjust to postpartum life. Some parents experience changes in vision or hearing after childbirth. If you've noticed any changes, bring them up during your annual physical. Your provider can perform basic screenings and refer you to a specialist if needed. Early detection of vision or hearing issues ensures you get the right care and maintain your quality of life. Pregnancy and childbirth can sometimes affect your immune system or trigger new allergies. Ask your provider about any new or worsening allergy symptoms and discuss ways to support your immune health. Your doctor can recommend allergy testing or suggest strategies to reduce your risk of illness. Keeping your immune system strong is especially important as you care for a young child. If you're experiencing ongoing pain, whether it's back pain, joint pain, or headaches, bring it up during your checkup. Ask your provider about safe pain management options, especially if you're breastfeeding. Your doctor can recommend medications, physical therapy, or alternative treatments to help you feel more comfortable and active. Fatigue is common after having a baby, but persistent low energy can signal underlying issues. Ask your provider about possible causes of fatigue, such as anemia, thyroid problems, or sleep deprivation. Discuss strategies for boosting energy, including nutrition, exercise, and rest. Your doctor can help you identify and address the root causes so you can feel more energized. Parenthood can be overwhelming, and it's important to have support. Ask your provider about resources for emotional support, such as counseling, support groups, or community programs. Discuss any feelings of isolation or stress, and explore ways to build a strong support network. Your doctor can connect you with helpful resources to make the transition to parenthood smoother. The transition to parenthood can impact relationships with partners, family, and friends. Bring up any concerns about relationship changes during your checkup. Ask your provider for advice on communication, managing stress, and maintaining intimacy. Your doctor may suggest resources or counseling to help you navigate these changes and strengthen your relationships. Returning to work after having a baby can be challenging. Ask your provider for advice on balancing work and family, managing stress, and maintaining your health. Discuss any concerns about pumping, breastfeeding at work, or adjusting to a new routine. Your doctor can offer tips and resources to help you transition smoothly back to the workplace. If you have questions about childcare, such as choosing a provider or managing separation anxiety, bring them up during your checkup. Your provider can offer guidance on finding quality childcare, preparing your child for transitions, and supporting your own emotional adjustment. Addressing these concerns early helps you feel more confident in your parenting decisions. Beyond birth control, you may have questions about future pregnancies or expanding your family. Ask your provider about the ideal timing for another pregnancy, any health considerations, and how to prepare your body. Discuss any concerns about fertility or genetic risks. Your doctor can help you plan for a healthy future, whatever your family goals may be. Protecting your baby means ensuring everyone around them is healthy. Ask your provider about recommended immunizations for family members, such as the flu shot or Tdap. Discuss strategies for keeping your home environment safe and reducing the risk of illness. Your doctor can provide guidance on building a healthy, protected family unit. If you're taking any medications, ask your provider about their safety while breastfeeding or caring for a newborn. Discuss potential side effects, interactions, and alternatives if needed. Your doctor can help you weigh the risks and benefits, ensuring both you and your baby stay healthy. If you use tobacco, alcohol, or other substances, talk openly with your provider about their impact on your health and your baby's well-being. Ask for support or resources to reduce or quit if needed. Your doctor can offer non-judgmental guidance and connect you with programs to help you make healthy choices. Body image can be a sensitive topic after childbirth. If you're struggling with self-esteem or adjusting to physical changes, bring it up with your provider. Ask for advice on building a positive body image and discuss any concerns about eating habits or exercise. Your doctor can offer support and connect you with helpful resources. Safe sleep practices for your baby are crucial. Ask your provider about the latest recommendations for infant sleep, such as sleep position, crib safety, and room sharing. Discuss any concerns about your baby's sleep patterns or routines. Your doctor can help you create a safe and healthy sleep environment for your child. If you have questions about your baby's growth or development, bring them up during your checkup. Ask your provider about key milestones, what's typical, and when to seek further evaluation. Your doctor can offer reassurance and guidance, helping you support your child's healthy development. If you plan to travel with your baby, ask your provider about travel safety, vaccinations, and tips for managing routines on the go. Discuss any concerns about car seats, feeding, or sleep while traveling. Your doctor can help you prepare for a safe and enjoyable trip with your little one. Financial stress can impact your well-being as a parent. Ask your provider about resources for managing medical bills, accessing community support, or finding affordable care. Discuss any concerns about insurance coverage or financial planning for your family's health needs. Your doctor can connect you with helpful programs and support. Understanding your insurance and benefits is key to accessing care. Ask your provider for help navigating your health plan, understanding coverage, and maximizing your benefits. Discuss any questions about referrals, copays, or coverage for postpartum services. Your doctor's office can often provide guidance or connect you with a benefits specialist. Many communities offer resources for new parents, from parenting classes to food assistance. Ask your provider about local programs that can support your family's needs. Discuss any barriers to accessing care, such as transportation or language. Your doctor can help you find and connect with valuable community resources. Being prepared for emergencies is important for every family. Ask your provider about creating an emergency plan, including first aid, emergency contacts, and supplies. Discuss any concerns about your home environment or safety. Your doctor can provide tips and resources to help you feel more secure and ready for the unexpected. Self-care is essential for postpartum parents, but it's often overlooked. Ask your provider for tips on prioritizing self-care, managing stress, and finding time for yourself. Discuss activities that help you relax and recharge. Your doctor can suggest strategies and resources to support your well-being as you care for your family. Your annual physical is a great time to set health goals for the coming year. Ask your provider for help creating realistic, achievable goals related to nutrition, exercise, mental health, or family planning. Discuss strategies for tracking progress and staying motivated. Setting goals helps you stay focused and proactive about your health. Reviewing your medical history with your provider ensures you're up to date on screenings, vaccinations, and preventive care. Ask about any changes in your health since your last visit, and discuss your family's medical history. Keeping your records current helps your provider offer the best possible care. Open communication with your provider is key to getting the care you need. Don't hesitate to ask questions, share concerns, or request clarification. Your doctor is there to support you, and honest dialogue helps build a trusting relationship. Remember, no question is too small when it comes to your health and your family's well-being. To wrap up, your annual physical is a valuable opportunity to address a wide range of health topics as a postpartum parent. By asking the right questions and discussing your concerns openly, you can ensure you're on the path to recovery and long-term wellness. Remember, your health matters not just for you, but for your entire family. Take charge of your well-being, and don't hesitate to seek support whenever you need it. Wishing you a healthy and fulfilling journey through parenthood.